Hey everyone, we're back for a special Sapien podcast. This is our COVID episode, and this one has been a long time coming. We thought a lot about it. I'm here with Dr. Gary, and I'll let him introduce himself in a second. And he went on some rants. We got some great information across. This is not the stuff you're hearing in the media. This is not the stuff that maybe you're comfortable talking about. And we talked about it. We got into it. We didn't use all kinds of data. We just kept it to this high-level idea of what can we do? What's going on? What did we get wrong? What else did we do, Gary?
Look, I have a lot of strong feelings. I've been on the front line of this thing for the last year. A lot of what I said is going to upset people. A lot of what I said is really hard to hear. Some people might disagree. I just ask people to keep an open mind, realize that this is my experience, my opinion, Brian's experience, and Brian's opinion. That the situation is ever changing, but that we challenge you to open your mind, think outside the box, see through the lines, and just think about what is happening and look around and let your mind embrace different ideas.
I love it. No, yeah. I always say just listen to both sides. I think this will be a great episode that you might want to share with people who aren't, they've bought into the mainstream paradigm and they haven't heard a doctor talk like this before, because Dr. Gary is really put himself out here, talking about these things. It's a bit controversial, but there's no conspiracy theories. We didn't get into any wacky stuff. It's all just based on our opinion and good science. And I think you're going to really enjoy this episode. And before we start, we'll just mention sapien.org. We don't want to do a bunch of plugs. Everyone knows about the program, the tribe, and Nose to Tail. Get your meat and other great products there, and just enjoy the episode.
One last thing. Please listen to this whole episode. Don't take pieces out of context, and really, really listen to what we're talking about. Even if you disagree, there's something you can gain from it. Thank you, guys.
And we're back for another episode of the Sapien Podcast. I'm here with Dr. Gary. How you doing today?
I'm great, Brian. I'm very excited to be here today. I've been looking forward to this podcast.
This is a long time coming. This is the COVID decompression episode. This is where we get to lay out all our thoughts. I'm sure everyone has had a lot of thoughts in the past 8 months. We haven't had a great way to express them online or, talking to each other, and we've been saving it up for this episode.
Yeah, and just so everyone knows, we want to share our opinions. We want to share the observations that we've made. We spend our lives committed to helping people find a healthier life. I spend every day seeing patients. Brian spends his days talking to people from around the world. This is our obsession. This is our passion. This is everything we live for. But don't get it twisted. This is not medical advice. This is our opinion. It is also timely. We know what we know as of, what is even the date? It's like November 17th, 2020. And we're constantly learning. We're in the middle of a second, third, or whatever wave of these case rate increases. And people are nervous. I can't even express to you guys how scared patients are in my clinic. Or how frustrated or how depressed. And so a lot of this is us sharing what we know, sharing what we think, and frankly, not to get on a high horse right away, but there's a lot of censorship going on. I know that, Brian, on your platforms, you've experienced the censorship, and we get to say our opinions. We get to say what we think. Too few of my doctor colleagues are speaking up. And I find that terribly sad for our society. When you have some of the smartest, most educated people afraid to speak up, you get a very, very sad state of affairs. And when we're in the middle of a medical disaster, for lack of a better word, to hear so many of my colleagues either sit on their hands and silently not say anything, or worse yet, in my opinion, promote the same redundant ideas that are barely evidence-based, and we'll get into what that means, but it's sad to me. So I want to tell everyone, thank you for listening. Please take everything we say with a grain of salt. Do your own research. We'll make references to podcasts and books and studies. Look them up. Make up your own mind. Think for yourself. Let us be a guiding light, if you will, or a source of ideas and thoughts. Don't let this be like, we reserve the right to change our mind.
Or
by
be
the
wrong.
Be wrong.
But we love that we live in a country that we can still be free and we can speak our mind, and then maybe we're wrong. But that's how discussions move forward, is open discussion and not just censoring things and deleting posts and not even allowing things to be shared in the first place. So I want to get your take on it because you're the doctor, you're in clinic. Maybe we can start off with how that's been, right? Like you've seen it from a different angle than other people.
Yeah. So I'm on the front lines, if you will. I have a private medical practice in Los Angeles, and I never in a million years would have thought I would have been, navigating the waters of a pandemic, a medical disaster. I've stayed in close contact with my colleagues in the hospital so that I can kind of maintain that perspective. And people should know, I also see people at their homes as a hospice physician. I'm seeing people at the end of their life. I've during the pandemic, started doing a lot of home visits as really high-risk patients can't go seek help. And unfortunately, not all medical services can be rendered through telemedicine in a meaningful way. And so I've been doing that. Right now, we're seeing in our hospitals a lot of people dying and coming in very, very sick because they have neglected pursuing medical care. Sometimes they have a COVID-positive diagnosis. COVID did not kill them. Keeping them at home and not opening doors and creating channels for medical care has killed them. So my feelings are mixed. As many of you can tell, I'm pretty fired up right now, so I do apologize for raising my voice and getting emotional, but it has been emotionally destructive, for lack of a better word, because in the beginning, we did not know what we were dealing with. So you prepared for the worst, and that's what we did. I have a small, loyal, and highly effective team in my practice of nurses and assistants, and everyone was ready to be there for everyone, for all of our patients and for all the people that would come our way. And as things started rolling out and we found out more and more about this virus and what it really is and how it affects people, we started seeing the real fallout. So what many people might expect to hear is, oh my God, there was dozens and dozens of patients coming with COVID positive and they were all sick and I had to order all these drugs and send them to the hospital. No, this is not that, right? This is not the virus from the movie Outbreak that kills people in 4 hours. This isn't the death rate. The actual number of people that die and end up in the hospital from this infection is not that significant compared to many, many other viruses that we have. But our response has been devastating. The lockdowns, the lack of support for physicians, doctors, and hospitals to maintain effective services has left people afraid, alone, at home, with an overwhelming amount of information that is confusing and horrifying. I've never seen so many folks with mental breakdowns. I've never seen so much exacerbations of depression and anxiety. I see people that were well-adjusted, holding their life together, exercising, going to the gym, having meaningful relationships. All of this ripped away from them. And
before, so this is before COVID and then after.
Sort of through the process. I'm kind of going through what happened in the beginning where we're all very, very afraid. And then as things roll out and it becomes not what they said it was or we thought it was, and then the response doesn't change and the social fabric changes in a negative way, and I am seeing the mental fallout, the mental disease that is a result of dehumanizing our society. And now it's been long enough, what are we, 9 months into this thing? We're seeing people that have been afraid to pursue medical attention. with chronic medical issues for a reason, because they were high risk people that are now sick from those chronic diseases because they're not managing well. They're not exercising. They're not going outside. They're not seeing therapists, doctors, physical therapists, aides. The whole system breaks. And while we're trying to avoid this virus, we have neglected to take care of our mental health and our physical health. And that's what we're seeing.
So unintended consequences, or people say that the cure is worse than the disease. It's a lot of things that no one thought of. So in the beginning, there was a stage of we didn't know what to do. Let's flatten the curve. And it's like 2 weeks to flatten the curve. And then it just kind of went haywire from there. And we didn't really adjust properly. Is that kind of what you're saying?
Yeah. Yes. We didn't make like this is what gets me. And this is going to upset people because this upsets me. And I know it's going to upset people to hear. What ticks me off the most is doctors on the front lines from a hospital, from the clinic, being like on social media or to their patients or whatever I hear from them. It's, listen, wear your mask, stay 6 feet apart, don't go outside. Like, we fucking get it. And that recommendation is hollow and meaningless. I'm sorry, but that's the truth. Whatever you feel about masks and whatever you feel about the actual efficacy of those interventions, that's not a meaningful recommendation when you're 9 months into a pandemic. Our society is coming apart at its core, and people are struggling. You should be talking about what they can do to protect themselves. Running and hiding is not doing something. We're going to talk today about how to build your immune system, what it means to be metabolically healthy. Our podcast, our company Sapien, is all about teaching people how to live a healthy life. And our recommendations are the meaningful recommendations. I want to tell a story. When all this started, and we got the very first evidence that this thing is attacking people with metabolic damage, diabetics, obesity, chronic medical disease.
Well, and the elderly, because they have a lot of those.
There you go. Because they've been listening to our terrible food and lifestyle guidelines for decades and decades and decades, and they have the sequelae of high sugar, high grain, high inflammatory seed oil diets. They have diabetes, they have obesity, and they're sick, and their immune system is compromised from age. So I'm talking to one of my colleagues in the hospital, and I'm telling her, I'm like, well, right now it's like April. If we just start a anti-obesity crusade and we teach people how to eat a low carbohydrate, whole foods-based diet, and we start getting people on appropriate supplementation that we know works, vitamin D, zinc, vitamin C, it's obvious. It works. We do this even today in our hospitals. If we can make that lifestyle change our priority, we will save countless lives. Countless lives from COVID and countless lives from the inevitable death that comes from these diseases. And I'm told, how? I can't get people to change their life. I can't get people to change how they eat. I can't get people to change their lifestyle. I can just treat them medically. I could give them drugs, and that's how I can fix them. And in the same conversation, it's back to the same thing. Stay 6 feet apart, don't go outside, and wear a mask. That's a pretty dramatic lifestyle modification, if you ask me. That's a pretty big ask, if you ask me.
They cancel Thanksgiving. Like, that's a huge lifestyle change.
So you can't stop going to McDonald's and eating fast food and Coca-Cola and having breakfast that's essentially dessert made out of low-fat trash products full of sugar and processed everything, right? But you can depersonalize reality by putting a mask on everyone, regardless of what their risk factor is, telling people to stay indoors for a respiratory virus that you have to be close to each other. I mean, if you cannot see the cognitive dissonance that must exist within a physician's mind to suggest the sort of the story that is being sold, the recommendations that are being sold, and to then say simultaneously, oh, well, your recommendations for immune health and lifestyle medicine is too much to ask of people. You've got to be not using, I mean, you can't, like it's horrifying to me. And I think, and I'm starting to feel that many of my colleagues and much of my training brainwashed me and brainwashed all of my colleagues into believing that the only way to help people is by driving disease out using drugs and surgery, the allopathic model of medicine. I know you know what I'm talking about. And instead of embracing the idea that we as humans have evolved to be healthy creatures, that we have natural mechanisms in place to bring us to equilibrium and health. That if we lean into a lifestyle that is healthful, food, movement, stress management, healthy sun exposure, sleep, if we do those things, that we won't be vulnerable to these viruses and diseases.
I love that. I always tell my story of I'm not getting sick. As soon as I change my diet and lifestyle, I haven't got the flu, haven't gotten cold, haven't gotten COVID, haven't gotten anything in 5 years. Because it bounces off. It's not that I haven't been exposed to it. I have to have been exposed to it. I share drinks with people. I share small spaces with people. I've flown on many airplanes. But guess what? I never get sick. Am I magic? No, because I used to get sick every 3 months like everyone else before I made these changes.
I think that's what I really want to bring this up about you, Brian, because I'm the same way. And it's like, you hear us talking and you see us and we're vibrant and we're excited and we're promoting these ideas, but it's like only a few years old, everyone. Like, we just figured this out. In all reality, it's not like we've been living this for 20 years of our life. We met in a fraternity and we were not living a very high quality lifestyle. We had a good time, but we made a lot of decisions that are bad for our health. And we saw the ramifications of that. And that's why we're here talking about this, because we found the answer, if you will.
Well, that's when I learned about the immune system in a really simple way. Is every year around finals, or maybe it happened every trimester. UCLA had 3 sort of trimesters. I would get sick around finals because I didn't sleep well. I stayed up all night studying. I was stressed out, and I was eating a bad diet. And it's so easy to know that your immune system's down. That's when you get sick. Is it a random coincidence? No. This is how the body works. It's very simple.
It's very simple. So let's get back to COVID for a second.
Yeah.
Right now, we're seeing like the second or third or whatever the media wave they want to talk about. But it's the middle of winter. The sun is gone in most parts of the country. We have been inside for 9 months. We have been avoiding going to see our physician. And many doctors, and I failed to mention, many doctors' offices have either completely closed down because a physician who's later in their practice, who is themselves vulnerable because they're not living a good quality life and they're older and they have money, they're out. They're out. If you've been thinking about leaving your practice because medicine has gotten really challenging, because the requirements for documentation are overwhelming, because the overhead is way too high and the insurance companies want to fight you to get every single penny, and patients don't want to pay their copay because they're paying out of their nose for the actual insurance and they don't want to give you extra money, you're out. So we're making our population more vulnerable because doctors are out. And then the ones that stay oftentimes are required to do telemedicine. And while telemedicine is great for some people, it is not a replacement for a real evaluation in person. So, go ahead. I mean,
I wanted to. Okay, so you were talking about the bad situation we're in, and we know there's good statistics on how many cancers go undiagnosed because of this. There's all kinds of statistics we can say. We decided to not make this a statistic podcast. We're not going to bring out all the charts and graphs and studies, but we can link to them. So that's one thing I'll say. And two is I want to say you're not anti-mask, anti-distancing. You're into a smart version of that, or where appropriate, or just that shouldn't be all that we're talking about.
That's it.
It shouldn't be all we're talking about.
That's it.
It's fine to do. It's great.
Well, this was my problem with my colleagues, is when you post that one time, and then you post it again, and then you post it a third time, acting like no one is listening to you, maybe there's other recommendations you can share with your platform. Maybe people are listening and this virus is still going to get past your silly paper mask. I'm not saying that masks do nothing, and I'm not anti-mask. I respect our leaders in our government who make recommendations and requirements, and I follow all of those in my practice and when I'm out seeing patients. But we need to hold ourselves and our leaders, physicians, to a higher standard. If you're saying the same recommendation that I hear on daily news, keep your distance, wear a mask, and stay home, you're not helping anyone. I'm sorry, you're not. It's the same thing as when you go to a doctor and they say, eat a low-fat diet. And then you come back the next year and your numbers look worse and they put you on drugs. Eat a low-fat diet. And then the next year you're more sick and you've gained 3 pounds. Eat a low-fat diet. Maybe they're eating a low-fat diet. Maybe you don't need to get mad at everyone for not listening to you. Maybe they're listening to you and your recommendations are not fully effective. Maybe it's not like the nutrition recommendations, which are bad recommendations. Eating a low-fat diet is not a good recommendation. I'm not making a direct parallel to wearing masks and social distancing. I do think those are reasonable recommendations. But there's a plethora of other interventions we can do here. We can lose weight through lifestyle modifications. You're stuck at home. You don't need to eat yourself into the next 10 pounds. Why don't we teach people how to really eat? Why doesn't the government put money into giving everyone real meaningful nutrition education? Meaningful, not the same shit we've been giving to people. Why are you telling people to stay out of the sun when you know vitamin D is essential for hormone production and for your immune system? Why are you not supporting supplementation? Why are you only promising one solution, a vaccine? How is that the only solution? When has a vaccine ever been the only solution? I'm not even saying I'm right about everything. I just want people to think and ask questions and realize that saying the same thing over and over and over again when it doesn't work is called insanity. And that we need to think more broadly and we need to really, really evaluate if the man on the TV with the news logo is actually giving you good advice. And if seeing the same 3 doctors on TV giving the same recommendation is really smart, and maybe we should open our eyes and listen to more people. You know, this comes to question of the doctors that stood up and said, well, there are treatments for COVID. There are different ways to manage this.
You're talking about the censored doctors?
Yeah, they got censored. In fact, I won't be surprised if this gets censored because I'm a doctor and I'm taking a risk. I want everyone to realize, I'm nervous about saying this stuff, but I refuse to be on the front lines of this thing and know what's going on and keep my mouth shut because of fear, because the truth will come out. The truth is going to come out the time. You can't hide from the truth and reality. So I'm going to be on the correct side of history, and I'm going to give people meaningful recommendations. And my patients who I aggressively replete vitamin D, whose BMIs are in an acceptable range, whose blood glucose and fasting insulin levels are in an acceptable range, those people don't die. And you'll see that, and the evidence for that is already out there. To fearmonger on TV and show you some quote-unquote healthy person that died, that's not happening. That shit happens. But the 99, 95, whatever it's a crazy high number. People that are dying and going to the hospital are sick people.
They were going to die anyway, unfortunately.
I'll calm down. I'm sorry.
No,
I'm sorry.
I love it. I love this Dr. Gary rant. I'm just thinking about the healthy people they prop up. I just want to know why they are so into fear mongering. It's got to be beyond just getting ratings or selling their ads and their clicks, because it's so crazy when they trot out these supposed healthy people. For one, they look pretty obese to me, or they're vegan. Oh, this healthy vegan. Well, who said a vegan diet's healthy? These people look undernourished, or even they trotted out a sort of marathoner that got pretty sick. Well, it's like, I don't think you should do many marathons and just
Yeah, I know many.
stress on your body.
Right.
Right. I mean, we know that can cause problems and people have more sickness, stuff like that. So, but it's just why they keep sensationalizing it when we know that it's what the average age of death is over the average age
Of death.
of death. And
Wait, let's explain that, because I think we know exactly what that means. So if the average age of death is, what was it, 75, 68, something like that.
75.
75. So we'll go with 75. The average age of COVID death was higher than that. So that is to say that the people that are dying from COVID are older than the people that are just dying.
Mm-hmm.
So they're going to die. And this is something we wanted to talk about. We're here.
Mm-hmm.
Here we go, guys. This is going to upset you.
Okay.
This is going to upset everyone.
Do it.
Death is a part of life. In the early 1900s, 20% of people died in the hospital, and 80% of
To the camera.
You see me. In the early 1900s, the vast majority of human beings died in their home. 80%. As of this last decade, the same percentage, 80%, are dying in the hospital. We have removed ourselves from the reality that is life, which is death. Death is a part of life. Most people have not seen a chicken be taken from this world. Most people, the first time they see or cross death is when their animal dies or their grandma dies, if they're lucky enough to see that dying process. And I say that because you cannot escape death. Death and taxes. Mm-hmm. Everyone knows that saying. Mm-hmm. When we found out that a virus either released or morphed into this new strain, again, I don't care if it was made in a lab or if it came from a bat. I don't give a shit. It doesn't matter. Mm-hmm. I can't prove any of that. Mm-hmm. What I know is that this nasty virus came out. My thought was, a lot of people are going to die. Because by the time you find out, and these numbers are, the cat's out of the bag. There's no locking down the world. That's a fantasy being sold to you. And so when death is a part of life, you need to prepare for death, and you need to not fear it. You need to be thoughtful, embrace it, and treat people with compassion and love, and not cause suffering. So as a hospice doctor, I feel passionately about this because in America, we spend more money on healthcare than any other country by a lot. Look it up. It's insane. We spend more money in the last 6 months of life by more than a lot, astronomically more than the next country. And our people don't live. You can't avoid it. What we do is induce misery on old people. And I've said this a lot. I am not in the business of causing old people to suffer. When you put an old person who is dying on a ventilator and you keep them alive for a week while the family weeps at the bedside because you did not want to make the call for family and say this person will not be intubated or resuscitated because that's the society we've built, you induce suffering. My job is to do no harm. That means I have to make terrible, hard decisions all the time. By us as a society saying even one death from COVID is unacceptable. And I heard all of our politicians say that. Mm-hmm. Trump, Harris, everyone, Biden, everyone said that. You are lying. You are being disingenuous, and you are setting our society up for failure and pain because death is coming. Shit is coming. Instead of preparing people, investing even more into hospice and palliative care, building teams to go out to people's homes and supporting families, investing in mental health resources. No. We built ventilators. And we were so proud of us building these fucking ventilators. And what happened? Well, we were wrong. We were wrong that the ventilators didn't save anyone. That was not the way we could save people from COVID. We found out that there were other strategies we could use. And what did we do when we found that out? Nothing. We said, oh, another wave might come. We're gonna work on a vaccine. What about all the preventative medicine? What about giving people hope? What about the cognitive and psychological effects that your body has on your immune system? For those of you that don't know, your brain is extremely powerful. It can build your immune system. It can make you fight viruses. It can. There's evidence for it. And what did we do? We built more fear. And why? Brian, back to your question. Why have we done that? I worry, now this is a conspiracy theory kind of stuff. I worry that we make so much money on morbidity. That is to say, not death. You don't make money on someone dying. You make money on someone circling the drain for a really long time. Because those people get pumped full of drugs, the most expensive drugs. Those people get the most expensive interventions. And that's the medical model that we started in the early 1900s and serves us poorly today. Mm-hmm. And I guess it's not a conspiracy because you can, again, go and learn about how the modern medical system was developed.
It was shaped by big interests and big money.
Will you share with people, and I think this is important, I know we're a little bit all over the place, but I want people to know, like, how did we get here? How did we create a model that is so incentivized to keep people circling the drain? Not keep people healthy, not heal humans, but maintain a certain sick sadness and despair. See what you can do.
The quick version, I mean, you can learn all about this, and there's a lot of big interests and a lot of people that may have thought they're doing good. A lot of organizations like the Rockefeller organization that maybe thought they were doing good. Maybe they thought they were going to have a big payday by propping up the allopathic medical system. There's a lot of evidence that they purposely tried to shut down other avenues of holistic care, of diet and lifestyle, and they decided to push this allopathic model. And I mean, I encourage people to look it up. I'm not saying I know what happened, but this is in the early 1900s, and it's a lot of interesting information about big interests, not just, certain Rockefeller group, not just there's just a lot of interests out there that I'll say that aren't really aligned with people doing free diet and lifestyle interventions.
Yes. And this is a cool concept I want to share with people. So Brian's being very gentle, going around, kind of beating around the bush. There is a lot of interest in making medicine a big business. And it started in the 1900s. You could look up something called the Flexner Reports. Lots of really fascinating history there. But there used to be in the 1800s all sorts of different healers out there. There used to be something called empiricists, people that would use herbs, people that would manipulate the body, people that would give sort of homeopathic or very low dose therapies to try to help people. Probably a lot of those therapies did nothing, but because the human body is so well adapted at healing, it worked. Then there was allopaths. Allopaths in the late 1800s and early 1900s were scary. They gave very aggressive drugs, often poisons like heavy metals, mercury, things like that. And they did surgery. They cut it out. So allopathic medicine is what we call like regular Western medicine, right? And the root, I'm not saying it's bad. What I'm saying is the root of it is in the concept of driving disease out of the body. So it is a disease-centered model where my job as an allopath, and I am an osteopath, and I'll explain the difference, as an allopath is to give you drugs or cut the disease out. Identify, diagnose the disease, and get it fuck out of there, okay? That was pretty brutal when we didn't have good interventions. So people were very resistant to allopaths. As the 1900s kind of progressed, there was this organization that went through the country and got rid of anyone who was not practicing evidence-based medicine. And evidence-based medicine is to say that we did research and we showed that one intervention is better than the other intervention, and that's how we're going to practice medicine. And through that process, they got rid of anyone that wasn't practicing allopathic medicine. I'm summarizing and I'm simplifying, but that is essentially what they did. There was a small group of doctors called osteopaths. And Stills, A.T. Stills was the leader of that kind of movement. And he was an MD that was like, hold on, maybe we don't need to drive disease out. Maybe the body has a natural mechanism to heal itself. Maybe we can manipulate the body physically. That's where the word osteopath comes from, moving the bones and give herbs and do natural things, food, sun exposure, which has been used to treat all sorts of maladies throughout history. And that mechanism might be better than driving this disease out.
Well, prevention. It's all about setting up the body to heal itself, like humans have been doing for all of time.
So osteopaths were called quacks.
They coined the word quacks back then.
Quackery.
Yeah, this group, it's like the original lobbyist groups where these groups would smear other groups of doctors calling them quacks. Okay, keep going.
So this is a history of, if you don't believe what we're talking about, we're going to vilify you and excommunicate you from even having a voice. This is the same story that's going on now, by the way. So osteopaths, because they were still practicing some components of allopathic medicine, were able to maintain some medical colleges. Most other alternative, quote unquote, or empiricists is the word they used to use back then, because empirical treatment versus like evidence-based treatment, which is what the allopaths were trying to anchor. And again, I love evidence-based medicine, but that is not the end-all be-all. There is way more, like hundreds of thousands of years of human evolution and culture where we evolved to be the dominant species on this planet without allopathic medicine. Okay? So you don't need it. You don't need it to be now, okay, whatever. So then as I grew up and I became a doctor, I had no idea about any of this. And the only doctor I knew was the MD, the medical doctor. And that is the allopathic model. And as I went through my process of becoming trained, I realized that there's alternative options. Osteopathic medicine was very attractive to me. I went to an osteopathic college of medicine where they taught me everything from manipulation, moving around the fascia, moving around the bones in the body. They even gave us a course on Reiki. They gave us a course on acupuncture. They gave us a course on herbal medicine. We actually got some education on supplementation, which is very, very rare. But they did not give us extra education on nutrition, for the record. So we got the same education in the world of nutrition. So basically, through that process in the early 1900s, they took out anything that wasn't disease-driven medicine. And now we are dealing with an infection that has no like acute, obvious treatment. And the only thing they can sell you is a vaccine. This is the way we're going to drive the disease out of your body and out of our society. We're going to give you a vaccine instead of a preventative approach where you build the patient's immune system, you build our population's health, you create a healthier population, which can be done and could have been done in the last 9 months. I'm sorry, it could have been done.
I always use Laura Spath, our friend who lost 140 pounds in a year. And why it's almost a year now. Someone could have technically lost 140.
And you don't need to lose 140 pounds, by the way,
No, not
right?
at all. The first 40 pounds, and you're probably in a way better state.
I mean, I have patient after patient, and we could mine my data, and we will mine my EHR, my health record. But I have patient after patient after patient who have started the Sapien Diet and Lifestyle program, and within 3 to 6 months had a full reversal of their A1C out of a pre-diabetic or diabetic range, had a normalization of their thyroid function in a lot of them, which I was not expecting to see, and it's very, very interesting to think about. Weight went out of an alarming like obesity BMI range. And essentially, and through that process, I've also aggressively replete vitamin D, normalized their vitamin D. And those patients are not high-risk patients. And I did that in 3 to 6 months.
No one said this. I love that Bill Maher was one of the only people talking about this in the mainstream. And he was on the side of these sort of liberal politicians that seem to be more pushing this type of agenda. And he was calling them out. You guys are not talking about this at all. No one has talked about diet and lifestyle once. How every week you'd go on his show and be like, why aren't we talking about this? Why?
I am perplexed why a company like ours, and we're not the only ones, is not being aggressively pursued by venture capitalists to help us expand our reach. And Moderna or AstraZeneca are just the golden goose that's going to lay this vaccine egg that's going to heal our planet. Bullshit. Vaccines are a tool, just like supplements and vitamins, just like medicines, and honestly, just like nutrition and lifestyle. But at the heart, the main core, the foundation of health, it is nutrition and lifestyle. And we have completely shitted it up, ignored it. We've put it into the fringe where we have to sit in a podcast studio and try to get people to get excited about it. You know what I mean? It's like, it's despicable.
We're the quacks. We're kind of the quacks of the doctor and nutrition world, that we have to be shouting, get Dr. Gary all fired up about simple interventions that humans have always used, and we're the fringe quacks.
Look, I'm not a quack, by the way. Let me tell you something. When I started talking about this stuff, and I was still in the hospital like 4 years ago, the doctors were alarmed at what I was saying because I was calling their shit out. I was like, your LDL recommendations are trash. Your grain and fiber recommendations are not good, and they're not anchored in real medicine. The doctors would get scared. And what happened? I left the hospital. I started my practice more aggressively. I went back, and lo and behold, so many doctors have lost weight eating a low carbohydrate diet and intermittent fasting. And I asked them, do you recommend it to your patients? No. Why not? Because that's not the recommendation from the American whatever association. It's time we stop just leaning on these big mega companies and corporations, and you start using our fucking brains.
So some of them actually followed your advice.
Yes, many.
I know that a lot of the nurses did.
So there's a movement of nurses that really heard me, and they were struggling, and they talk to doctors, and they see their obese doctors that are miserable, that are overworked and not taking care of themselves and giving everyone the same recommendation, and they see it. So they saw me losing my mind, being like, holy shit, I figured out how to actually help someone. And I had, I don't know, a dozen or so nurses come to my practice. Many of them are now off the majority of their medications. They're out of diabetes. I was trained that diabetes is we've said this, but diabetes is not a chronic, irreversible medical condition. That's bullshit. It is a food-driven, lifestyle-driven disease that can be reversed. Sure, insulin sensitivity is kind of irreversible, but if you stick to your diet, you can control that shit without drugs. And then there were doctors that did it, and they were embarrassed. They didn't talk to me about it. I know they heard it from me, and then they saw that it was bubbling up in sort of the public consciousness, and they tried it, and it worked. And they're still too afraid to tell their patients because they don't want to go against recommendations, because so many of them are fear-mongered. And I know I'm going to catch a bunch of heat for talking shit on my colleagues, but I'm sorry. Everyone needs to stand up and expect more from your doctor. Mm-hmm. If you go to your doctor and he's morbidly obese, don't go to him anymore. And if he realizes that no one's going to him because he's morbidly obese, then it's time for him to lose some fucking weight. That's the game. You wouldn't go to a workout guru. You wouldn't go to a personal trainer who's all like horrible, right? You wouldn't. Why are you going to a doctor that's depressed to ask him for depression medications? No. Okay, so back to the point. Death is a part of life. People are going to die. When now we're in winter season, there's going to be more deaths. That's the deal.
This is how viruses always goes. We've had coronaviruses for a long time, and this is how they go. They're seasonal. They get the vulnerable in the beginning, and this wave, these graphs. If you look at the death counts in any country, they follow the same basic pattern. Well, it actually depends on what latitude they're in, right? In the north or in the south of the equator, you have different things, but shapes, but it's very predictable, right? And then it goes by season, right? Or I already said season, by the year. So in previous years, let's take Sweden, for example. Sweden had a very light flu season the past 2 years. They didn't have that many deaths. So in the beginning of this flu season, they had a lot of deaths, right? If you look at it over time, it will even out. This is what you alluded to in the beginning, is in time we will prove that this is not what we thought it was, because we will see the patterns in worldwide and in deaths and what would have already have happened, right? And then you can look at when countries lock down, and these are all these interventions that they do, and then you can see the curves, how they're supposed to look, and there was actually no change when they did certain measures. So this is why some of these, why people are questioning some of these recommendations, or these one-size-fits-all solutions.
That's really it. And he just got to it. So there are so many variables, right? There's seasonality, there's age, there's local population risks. Like if you have a very, very dark population in a northern part of the world, they're going to be more vitamin D deficient and more susceptible.
They can't get the sun through their skin just because
their ancestors weren't in the cold north, and they were built to be in the sun all the time. So their vitamin D needs to be supplemented aggressively.
And we saw this in Italy. We saw this with a lot more African Americans dying. We saw a lot of way older people in Italy too. There's all these factors that people aren't picking apart. We just like to look at the big data and make conclusions from that.
The obvious stuff, right? There's a lot of subtlety. So I think that Ivor Cummings is someone we want to mention, because this is a guy who has spent the last year dissecting the data from around the world and making some really fascinating sort of explanations about what's going on. And we will not do him justice over here, because we have both listened to him and learned so much. But if you really want to learn about the data, the facts of do lockdowns work? What are the real factors affecting death rates? Reach out. What would be a great resource for people?
I guess just go to his YouTube channel.
Yeah.
Just go to Ivor Cummings' YouTube, and he does it all. I mean, the seasonality, just the Sweden part, right? Just the Sweden part is a good example of how a different way to handle it, right? Everyone knows by now they didn't have the crazy lockdowns. They didn't have any of these state mandated things. And they did have, initially they had some deaths, but these are the vulnerable people. This goes back to the death is a part of life. So these people are going to die anyway. Sadly, this is bad news. These people were going to die of anything, of flu, of anything. And they happen to be
your nursing home population in any country is vulnerable.
Yeah, and it was very sad. And Sweden admitted that they didn't do well with their nursing homes. They didn't lock them down properly. They didn't take the correct measures. But then they got past it, and they had a bad initial wave, and now they went back to normal. And everyone's living life. I've seen many, many videos. I've heard people's firsthand accounts, and they're back to normal, and they've developed community immunity or herd immunity, and people are trying to deny it. People don't want to bring it up.
Because you can't outrun this virus. You can't trick your way out of it. And so right now, we're seeing this huge spike in positive cases because it's winter, and this is when we see this. And while there's deaths, right, because there's more exposure, and we still have plenty of vulnerable people because we have a very, very sick population in America. Our obesity rates, our diabetes rates are through the roof. Our vitamin D deficiency epidemic is through the roof. People are on immunosuppressive drugs. People are on drugs for their heart and for cholesterol that may be suppressing their immune system. There's a lot of sickness in America. So when you see during the flu season deaths going up and they promote all these numbers, you have to think deeper. The death rate is going down. Maybe that'll change by the time you're listening to this podcast. I don't know. I get to be wrong, but I'm telling you right now, no one's going to escape this. The vaccine's not going to save the world. The only reality is that we have to take responsibility for our own health.
Absolutely. That's the number one thing. That's all I want to say is I don't get the plan. What's the plan? You can't cheat nature. We can't just think that nature or technology, or not nature, technology and medicine is going to save us. It doesn't work like that.
It's made us sicker. And this one-size-fits-all protocol. So giving everyone the same recommendation. Hey, no matter who you are, wear a mask. Children 2 and over, wear a mask. Come the fuck on. That's not a good idea. That's obvious. One could argue that it's child abuse to put your 4-year-old in a fucking mask when they go to the playground. If you're that worried, stay home. Don't put your kid in a face mask and create a culture of fear. This is going to piss people off. I'm dead serious. You want to create a shitty world? You put all of the children in face masks and you make them afraid of each other. You will get a shitty world. And that's what I'm afraid of. And that's why I'm sitting here putting my ass on the line with Brian, exposing my personal thoughts. People aren't going to like it. But if you want to brew horror, fear, and a lack of compassion, then you put children in face masks for a virus that's killing maybe as much as the flu kills. Maybe a little more. You know what it's not? It's not the virus that's in all the movies that kills all the people and then they like shut down the whole world like they're acting on the media. And everyone is culpable. The right, the left, everyone is playing into this bullshit. Even just today, Gavin Newsom, our governor here in California, wants to start shutting everything down again, but he's out at a party. Oh, I'm sorry, everyone makes mistakes.
At a birthday party at this super fancy restaurant with 12 other people.
That guy can go fuck himself. I'm sorry.
And Nancy Pelosi's getting her hair cut with no mask on.
Look, it's not fair. It's disingenuous. And our leaders need to be held to a higher standard. So one size fits all protocol doesn't work. What would I do? Dr. Gary, what would you have done? I would create protocols for nursing homes and facilities where people are more vulnerable. I would create a task force or whatever you want to call it that guides these organizations to protect the vulnerable. I would give recommendations to anyone with obesity and diabetes and anyone over the age of 65 to protect themselves, stay home, and give them mechanisms by which they can pursue the needs that they have. I would encourage young, healthy people that are not at risk of dying or death to be out there and be the ones holding up our country and our society, just like they were when we were in a war. You step up. You ask the people that can step up to step up, and you protect the vulnerable. You don't create a culture of fear. You do not ruin our society at its core with recommendations that are not supported by evidence. I'm not saying masks don't work. I'm not saying lockdowns don't work at all. But it's not this clearly effective thing like, oh, we're the party of science. No, you're fucking not.
The science is not settled.
He said it.
The science is not settled.
The science is not settled, and it won't be for a really long time. And we used to have to use fucking common sense. And the generation, the age of listening to common sense is gone. And this is my problem with evidence-based medicine. Evidence-based medicine is a powerful tool. It can tell you if one drug is better than no drug or another drug. It can tell you if a new treatment is effective compared to not another. But what it can't do is give you all the answers. So when you cut out everything that is not evidence-based medicine, when you cut out traditional healing modalities, when you cut out anything that hasn't been proven,
or just censor another opinion or another side,
I was kind of echoing the story of like American medicine, right? But what you're saying is now when you cut out any dissenting opinion, when you do that shit, you create more disease, you create more turmoil, and you give people no hope. And that is where my people in my clinic, this is where people on watching these news networks, this is where they're at. They have no hope because you're telling them to wear a mask, stay home and quarantine and stay 6 feet away. And when they do that and there's another wave, you say, keep doing that shit. You're not doing it. Or they are, and you're giving bad recommendations.
Well, and there's lots of data that shows this. I don't have all the numbers. We decided not to do numbers podcast, but 44% of the cases, I think, were spread through indoors, through families, just at home, indoors, so who were locked down. There's also data on people who wear masks still got it. We know that the grocery store workers throughout the whole pandemic, I remember going to the grocery stores in the beginning, they weren't even wearing masks. They had no shields. In the first month, they had no shields, they had no masks. At my local store in LA, and they didn't get it more than anyone else. So I'm not saying it,
Brian's study from the CDC from September says 70.6% of those who infected always wore a mask, and 14.4 in addition often wore a mask. So what we're saying here is that 85% of people who were infected always or often wore a mask.
Yet they still got it.
They still got
And
the
then
infection.
there's another one. The people, when we say that we can't hear other opinions or that we're trying to censor voices, what about Fauci in the beginning saying that masks don't work?
It's because he actually, I love that you bring this up. I do not like Anthony Fauci. I think he is being, I don't know if he's consciously being lying to people or if he's just a shill for someone else, but he is not giving good recommendations. When you look at evidence of face masks and its ability to protect against viruses, there's been a few studies before COVID. This is not like the first time we've had a virus, right? So we've looked at this before, which is why we don't wear face masks in America, because we did evidence-based medicine on this shit and we figured it out, right? So it did not, especially the fabric mask for sure, the paper mask for sure, and the surgeon mask, what everyone's wearing. Yeah. They are not effective in preventing the transmission of viral particles. So when you hear on CNN we did an observational study at UCLA, they sneezed and they showed with like infrared cameras that like the spit particles didn't go through. That's shitty observational research that means nothing at all. It's like using epidemiology to talk about nutrition. It's irrelevant. It might suggest something, but it doesn't prove anything. So there was plenty of studies that showed that these masks, unless it's an N95 that's fitted to your face, doesn't really do anything for viruses. And in fact, it went further to say that because the mask was on the face and people in real situations, not in a weird controlled lab, but like in the hospital is where they did the studies, would touch their face, they'd adjust the mask, they'd actually increase their exposure to pathogens. So this is obvious. This is why we never wore masks before this. This is why Fauci laughed at masks in March. This is why we didn't recommend, and currently the World Health Organization doesn't recommend wearing masks unless you're a healthcare worker taking care of COVID-positive patients. So I'm not anti-mask, but question the recommendations. Question when everyone keeps promoting the same stupid thing over and over again. Eat a low-fat diet, eat a low-fat diet. Wear a mask, don't go outside. And then someone else says, well, maybe there's something else. And they censor that person. I smell bullshit. When Brian or one of our carnivore colleagues gets censored because we're promoting meat, we might be right. When doctors go on front of the Senate and Congress and say, there's a treatment for COVID, and it's not quite as deadly as you said, and you remove that shit from the internet, maybe they had something there. I'm just saying, think about it.
I'm always just into looking at both sides. That's my biggest lesson in this nutrition endeavor I've been on, is you learn most when you look at both sides and you're open to both arguments. And once you shut down one side, you know something's up. And that's exactly what Gary said. But we need to move to kind of the answers here, the solution. Well, one, I want to hear more about a little bit more about your patients and what you've been seeing in clinic, because I know a lot more depression has popped up. You're having to prescribe a lot more medications for.
Yeah, I mean, I don't like to prescribe medications for mood disorder because I think that there's so much that can be done with lifestyle. And I think I teach people kind of how to manage chronic stress using acute stress. And we can talk about that, but we've talked about it in other podcasts. When you get to a situation where people don't have options, they can't go to the supermarket, they can't go to the gym, the parks are full of homeless people in Los Angeles, and people are afraid to leave their house. That's a real thing. You're left with no other choice. I've never had to prescribe more benzodiazepines for anxiety. I've never dealt with so much insomnia and depression.
You never have until COVID.
Like as a primary care doctor, it's like 10 or 20% of my practice. People come to me in general because they know I practice lifestyle medicine and I teach people different strategies that an average doctor won't teach them. And I think that, even with all that, when you have this overwhelming wave of mental health disorder, and it's, it goes from 20% to 70 or 80% of the patients I'm seeing. When that happens, I think, you're left with tools that you can use. And so I do use anxiolytics, antidepressants to get people through the hump. I've never seen, in the 3 years I practiced before COVID, I never saw a mental breakdown. I'm probably lucky. A lot of people have. That's not like, I think it's a little more common than that, but I've seen like half a dozen in the last few months. And, I'm really proud of how my office has dealt with it. We follow all the COVID protocols and precautions. We take it very, very seriously, but we have stayed open. We've stayed available, and we've stayed healthy because we're healthy. So, there's two things I want to say. I do want to get into our recommendations, but I just want to summarize it to say, if you listen to the Sapien podcast and you listen to Food Lies and you listen to the nutrition guidelines and the supplementation guidelines and the lifestyle modification guidelines, you won't get sick from COVID. If you've been doing that for the last few years, you'll be fine. You might get COVID. You might cough a little, but you're not going to die because your immune system is ready for a virus, which is all this is. It's a virus. It's a coronavirus. It's not some magical thing that's just going to crush you and kill you unless your immune system is not ready to deal with it.
Compromised.
It's compromised. So I just ask, I want to leave, before we go there, at what cost? What are we willing to give up? I wanted to bring this up because even if you're listening to me and you're like, Dr. Gary, you're out of your mind. The smartest people are on TV and they're, Fauci's brilliant and he has way more experience. He's been a doctor for 40 years and you don't know what the hell you're talking about. You're just obsessed with the Sapien diet. What are you talking about? I want to ask you, at what cost what are you willing to give up for this virus? If you avoid getting the virus, but you've destroyed our public school system, you've destroyed many, many private businesses such as gyms and doctors' offices, when you've induced suffering by isolating old people and people that had cognitive impairments go into full-on dementia because they've been isolated from their family for 3 months, now 6 months. When you have people dying alone in their nursing homes, dying alone in the hospitals because the hospitals don't want to get another COVID positive. Hospitals don't want to get another COVID positive, so they don't let anyone in. When you have children that grow up in a world where they're afraid to hug their friend or their grandma, when you depersonalize and destroy the fabric of human society, what have you accomplished? And I think that that's a serious question that we should be asking ourselves every day.
Well, it's unintended consequences. And in the beginning, we didn't know. But we should have adjusted and realized there were going to be these unintended consequences. And I'll tell my personal story that's completely meaningless.
It's not meaningless, Brian.
It's meaningless. This is one anecdote out of hundreds of millions of people in this country. And my personal anecdote, I'm lucky enough to know 0 people that have gotten sick from COVID. They've had COVID. I've known people that had it. Many people have had it and they said nothing happened. 0 people that have gone to the hospital, 0 people have died. Yet I know one man that I had to go to his wake because he drank himself to death during lockdowns because of COVID.
Yeah.
My one meaningless anecdote.
I think there's a lot of truth there. I think that the evidence and the research will show that the treatment that we have come up with for this virus is worse than the disease by far. I think that will not be a question when all the politicization, I can never say that word. When all of this is over and we look back, we're going to see that we fucked up. It's going to be obvious. Just like the story with food, just like the story with sun exposure, it's going to be the same story. Mm-hmm. Bad recommendations based on not good evidence causing more harm than good. Mm-hmm. And that's why I'm here, because I made an oath to do no harm. And that's what I'm going to do. So let's get to the...
What can we do? The what can we do part, because you brought up the healthy people who are actually strong. They have strong immune systems. When people get the disease, when people get COVID in this situation, it's actually a good thing, in my opinion. They are helping us reach herd immunity. So if you have healthy people who are out in the population, that helps us build herd immunity. I just said the same thing twice.
No, but it's important. Like herd immunity is an important concept. We talked about it a lot when this virus first came out. We stopped talking about it when they started making a vaccine, because if you have herd immunity, you can't sell everyone a vaccine. I'm sorry, that's the truth. This vaccine is going to make a lot of people a lot of money.
Yeah, a lot of people in Sweden aren't going to want a vaccine because they have herd immunity, and they're like, "Why would we need this vaccine?" And also, Dr. Gary is not anti-vaccine.
Not anti-vaccine. I don't want to sell bullshit. I don't want you to lean on drugs and vaccines. We use tools. We use what I call an integrated approach to medicine. We use everything. Vaccines are obvious. Masks are obvious. You've all heard it. You've heard it over and over and over and over and over and over. And that's why we're here to talk about what else you can do, not vaccines. Mm-hmm. You can get a vaccine. If it comes out and it's safe, get it. It's fine. That's not the point. But you can do other things. So control what you can control. So I cannot control what the governor recommends. I cannot control what my neighbor does. I can get upset and yell and no one gives a shit. What I can control is how I support my life, how I support my body and my mind. Mm-hmm. So how can I build my immune system? So I think about the immune system as how can I make myself happy? Because I think they go together, right? Things that make you stronger physically, mentally, spiritually will build your immune system. It's crazy how that works, isn't it? Mm-hmm. So I use the paradigm of stress. Is it okay that I use this? Because I know I talk about this a lot. I'm kind of obsessed. I'm going to write a book about this, I swear.
Do it.
Okay. So chronic stress. Chronic stress makes us sick. Chronic stress makes us unhappy, and chronic stress suppresses our immune system, okay?
Same thing with chronic bad diets, chronic sugar, chronic anything. That's what we said, chronic marathoning will do you bad.
Chronic stress, short run, acute stress. Chronic stress, running too hard, breaks your body down. There's this idea of eating a little bit of like not so good food causes hormesis, acute stress. You eat a shitty diet all the time, chronic stress. So chronic stress is what makes us unhappy and is what breaks down our immune system. And you could think about that as a bad diet.
You could think about that as, how about news outlets making you scared every second of the day for 9 months?
You could definitely think about that. You could think about, a sedentary lifestyle as a chronic stress on your body.
That's why being forced to stay inside.
Damn, he's throwing daggers now.
What about the outdoor gym equipment? I live in this area by the marina, and they have this outdoor pathway. It's great. All the gym equipment's closed. It's these pull-up bars all taped up. They have chains around them. The whole COVID, I couldn't do pull-ups outside. Outside in the sun.
Even though early on they proved that this cannot be passed via fomites, which is passed like on physical thing on surfaces. So why are you going to close the outdoor gym equipment? Curious. So chronic stress makes us sick. How do we beat chronic stress? Well, in the Western world, we teach people to relax. Go sit on the beach. Go just chill out, watch a movie. It's good for you. You're going to relax. You've all done it. You've all went and relaxed. And
helps a little bit, yeah.
Helps a little bit. And then like a day later, when you get back into your workflow, it's game over and you're right back to where you started, right? So chilling and relaxing does not heal you, and it doesn't build your immune system. When you're laying on your couch or you're laying on the beach, okay, if you're on the beach, you're getting sun. So that's different. But
we'll just call it neutral.
Like it doesn't build you. So I always forget this guy's name.
Karan Kirshnan?
Karan Kirshnan, brilliant guy who Brian had in his Peak Human podcast, talked about building resiliency. So resiliency is your ability to handle chronic stress, okay? How do you build the resiliency? Through acute stress. So you've heard, if you want to like work out and like get muscles, you got to push through the pain. You got to like, if you really want to like emotionally grow. You have to get through the pain. That's acute stress. Acute stressors build your resiliency. They build your mind, your body, and your soul. It's true though. So when you do a high intensity interval training workout, when you go lift or you go run or something like that, you do some like sprints or a nice jog. Even a nice jog for a lot of people, by the way, is a HIIT workout, right? You cause a hormonal response that makes you stronger. It doesn't feel good right away. So you have to mentally push yourself through it.
Like sauna. It doesn't feel good when you're in for the 18th minute and it's really hot and you push yourself, you feel better. A cold plunge, it doesn't feel great, but you feel great after. It's amazing. The best I ever felt. I didn't even know why. I remember I was younger. I didn't know anything about nutrition. I'm like, why do I feel so good when I just did this?
I used to jump in the cold pool all the time. I love it.
Wow, I feel so great after.
So Brian wanted me to get through these. Acute stressors that we think about: high intensity interval training, heat therapy such as sauna, cold therapy, deep breathing, controlled hyperventilation. I think about that as an acute stressor. Fasting is another big time acute stressor. Those 5 modalities, when used with strategic application, thoughtful application, can build your immune system in a meaningful way.
Plus the diet. So this is part of the lifestyle. Part of the lifestyle is sleeping well.
Oh, so hold on. I was going to go there. So I think about the 5 acute stressors as ways to hack your hormone system, hack your immune system to build it up. I think about 5 mechanisms of happiness on a daily basis. It's a little bit different. I think about food or nutrition. I think about movement or exercise. I think about stress management. I think about sun, and I think about sleep. So if you're handling those 5 components every day, you're going to be happy and healthy. If you're leveraging those 5 acute stressors I mentioned every day in various thoughtful ways, you're going to build your body's hormone system, build your immune system.
Or every week. Yeah.
Or every week, whatever, you get it.
Those are more intermittent. The 5, I like those because that's a daily thing, but the other ones could be monthly or weekly.
I'm just obsessed with stress. I'm obsessed. My point is, all of the stuff that we just mentioned is free. You can do it by the sheer will of your soul. You just have to know. We cannot do these justice today on this podcast, but this is what you can do today. I will also add, since we're talking COVID specifically, supplementation. I think there's a huge role for supplementation, especially when it comes to immune support. We've talked about vitamin D over and over again. It's not enough to just think vitamin D. It's vitamin D3 plus K2 together as a team to get your immune system right. It's vitamin C if you're not getting enough of it in your diet. It's zinc, which is helping inhibit the virus's ability to get into your body. It's B vitamins that really support every mechanism. It's magnesium, which is highly depleted in our food system. So I think of it actually as like a food supplement or whatever. Those are the main ones that I think about that you haven't, that's
it.
Well, but then there's also other ways to think. Let's keep giving people tools. So if you're not able to eat a nose to tail, collagen supplementation, right? Omega-3s, I forgot all about omega-3s. Fish oil supplementation is huge.
You can just get cod liver too. You can get whole cod livers in tins. You get sardines in tins.
Now you're getting me excited.
Dr. Gary's a fan of tin sardines.
Okay. You can do stuff. You don't have to be afraid. You don't have to watch the news and worry that your neighbor is going to give you this virus. You can do something every day, all day to support yourself, to support your family. You can reach out to us. You can reach out to your doctor if they're still in practice. You can change your diet. As soon as you're done listening to this podcast, throw out the cereal in your pantry. Get rid of the shitty carbs. Simple. You just did something to boost your immune system.
I love it. I love it. We got to wrap it up here, but I think the last one you can do that I know Dr. Gary's going to love and he can do one more rant on is just embracing your fellow humans.
Oh my God.
Right? It's such a problem. So I play beach volleyball a lot and people won't even do a fist bump anymore. It's a practice in beach volleyball. Every time you switch sides, every 7 points, you give a high five to each player, right? And we won't do that These people don't. I'm like, no, I'm going to do it. And I tell people like, no, I'm giving you a high five. I'm going to give you a hug. You know, on certain occasions when I see Dr. Gary at his house on the weekend, I give him a hug. We got to just be our fellow humans again. Like we have to just be, we can't let the virus divide people. Like part of this news cycle is just destroying the fabric of society. It's making people hate each other. People, it's like this divide line. Friend groups are splitting up. Families are splitting up. Like, I don't want to wear a mask. He says we got to wear a mask. I think like, you know, Trump's right. I think Biden's right. It's insane. We have to just be humans again.
Yeah. And as humans, you couldn't have said it better. And as humans, we are social creatures. And this is super important. Like, not even humans, like mammals. If you keep a human from social interaction, they will lose their fucking mind and die. We know that. We've known that forever.
It happens to babies, especially. Someone just emailed me about this, about babies that will die. This is very well known. If you don't touch a baby, we used to have them in like the incubation chambers, and if you didn't touch them, they died.
We are social creatures. We evolved in a tribal environment, not in negative, evil tribes that tried to kill each other, although that was part of it, but we thrived on touching each other, looking at each other in the eyes, sharing stories, sharing pain, sharing love. This is the core of what it means to be a human. I think actually a funny connection is why these podcasts has become so popular, because you can really feel us when you hear this long form conversation, and when you just get like a 3-minute snippet between commercials, you just can't connect with a human being. So I think even the movement of podcasting has kind of like tapped into that part of humanity. And I think that, you know, all of the mechanisms that we're using as of right now are poisoning the well of humanity and our interpersonal relationships. So if you haven't seen your grandma, go get a COVID test, go put on a mask, and go give her a fucking hug. I swear to God, it's going to save her life, and you're not going to regret it. That's all I can say.
Yeah.
I can't. If you don't get it, if you're still scared after listening to this, bless your heart, and I wish you luck. But please, let's stop this culture of fear, and let's embrace each other as the human beings that we are.
We got to go out on that note. I love it. Let's go get a meal together, Gary. Let's be humans.
I love you, Brian, and I love all of you. Thank you.
All right, everyone. Thanks for listening. Please share this episode with friends and family. Give us a review on iTunes, and check out everything else we're doing on sapien.org. And we'll see you next time.